All right, it's March, and that means it's Colorectal Cancer Awareness Month. It is a very treatable cancer with a high survival rate, but you got to get screened. To learn more about the disease and how to catch it early, we're joined now by Dr. Mahsa Mohebtash, Chief of Medical Oncology and Hematology at MedStar Union Memorial Hospital. Doctor, thanks so much for coming in.
Thank you for having me.
So talk to us about what this is. I mean, you hear about the screenings and everything, but when we talk about colorectal cancer, what body part are we talking about?
So colon refers to large intestine. Rectum is the lower part of it. So colorectal is a short way of saying the cancer of large intestine.
Okay.
It's basically the same thing. It's a very common cancer. It happens in the United States, 150 or 140 new cases each year, but it's highly curable if it's caught early.
So how's it diagnosed?
You know, it's diagnosed by colonoscopy and biopsy, and we prefer the colonoscopy to be done before it, causes symptoms like weight loss, bleeding, or spreading to other places. And the screening colonoscopy does that. Anyone above age 50 has to have a screening colonoscopy. If you have family members with colon cancer, they need to start screening earlier.
So why do they consider the colonoscopy screening the gold standard?
Because it takes the tissue for biopsy and makes the final diagnosis. It looks at the whole colon. And also, in a way, it can be preventive because there are small growths in the colon called polyps that over the course of years, they can turn into cancer. And during colonoscopy, you can remove them.
Is it hereditary?
Some of them are, but majority of them are not hereditary.
So what about the cost for this? What if people are without insurance or underinsured? I know some insurances probably pay for it once you reach that age of 50, but for the most part.
So MedStar Cancer Network, we have a program that we can pay for the colonoscopy for people who are uninsured or underinsured. For any reason they cannot pay their high copay of their colonoscopy, we can help them with that. If anybody is interested, they can call the MedStar Health Cancer Network or just call tonight and we give them information.
All right, Dr. Mohebtash, thanks a lot for coming in. And there, folks next door in Studio B standing by to answer that question for you or any other calls that you may have. The number to call right there on your screen, 410-481-2222. And our experts will be in the studio waiting to take your calls until 6:30 tonight. Mallory, send it back to you.
Great information there. Thank you. Well, there was a